Hello, I'm Dr. Hal Stewart.
And I'm Dr. Adriana Corder-Stewart.
We do, in our practice, we see a lot of patients that have tongue and lip ties, and we do a lot of tongue and lip releases, surgical releases. And we won't do tongue and lip releases for any patient unless they have first had myofunctional therapy. A lot of people don't know what myofunctional therapy is. So, Dr. Adriana, you want to expound on that?
So myofunctional therapy is a therapy aimed to work on a dysfunction. It's usually the tongue. In the oral cavity, we've got the tongue, cheeks, lips. And so for a lot of people, they don't understand that there is a certain way to swallow. There is a certain way that the lips are supposed to function. And so it's about function. And when we look at function, we sometimes will collaborate with a myofunctional therapist in-house, or we refer out. But the purpose of it is to allow a patient to be able to participate in a therapy where they are understanding where that dysfunction is in order to prepare the tongue for the release.
Yeah, I kind of think of it if, people, even if you don't play golf, if you have a really bad golf swing, you have to be trained to get rid of those muscle memories, because when you have a bad golf swing, you do it the same way every time. So for people to correct their golf swing, they have to start doing it the right way. Well, if you have a lip or a tongue tie, your tongue cannot function properly. Your lips can't function properly. You can't swallow properly. So myofunctional therapy retrains the tongue and the lips on how to function. And so that when the lip or tongue tie is completed, then the patients recover faster and they reap the maximum benefits of that. So people ask, well, my 2-week-old daughter or son, infant, had to have a tongue release. Do they need myofunctional therapy? Well, obviously they can't go through a myofunctional therapy program because they're an infant. So Dr. Corder here, she does all of our infant releases. So tell them a little bit about what we do with infants.
Yeah. So of course, an infant, tiny, they're they can't participate in the therapy. So they're I like to call it oral yoga. There are oral exercises that a parent can do and to assist. And it's all about bringing awareness to the baby, to the infant, about the tongue, about the lips. So we're working more on the tongue for tongue tone, posture, and coordination. And then you'll have reflexes that build on top of that. So again, the main thing is to get that tongue working, because and essentially we want that baby, that infant, to become a nasal breather. And so the yoga exercises, when they're little, bringing awareness to the mouth. And then later there's tools. There's certain mouth props and tools that we can advise that continue to build on that, to build on to the next reflex.
Yeah, so you're actually training the proper muscle memory in that infant. They're not even aware of it, but that is possible to do, and then it makes them a better feeder and a better, they swallow properly, and the tongue and the swallowing and the way that the infant feeds and swallows, that plays a huge part in the development of their upper jaw, which will affect eventually, their dental, their teeth coming in, and their airway and the way they breathe. So infant releases are very important for children and adults, very important as well. The caveat is with children and adults, we do require them to go through myofunctional therapy, and that's one reason we get the great results that we do.